I'm Dr. Sindhu Hiremath from the Department of Dermatology and Aesthetics from Vaidehi Super Specialty Hospital. So acne is basically an inflammatory disease of the pilosebaceous units. So in simple languages, these units are present on the body, especially in the face, chest and the back. So these are the common areas of the acne which is seen. The usual causes which is seen are usually in the adolescent age group. As we can see in the teenagers, it's most commonly seen. Then in cases in PCOD females, they are most commonly seen. Those are the cases which present to us. And also we see in the gym goers who consume excessive amounts of whey protein or who are on anabolic steroids. We see it in those patients as well. So whenever a patient of acne approaches, so the basic lifestyle or dietary modifications which I advise them are, first, I would advise them to go on a low fat diet, which includes avoiding the consumption of junk food and chocolates like ice creams. Just avoid that. And if you're someone who has acne due to the dairy products, so I would advise them to consume less amount of dairy and dairy products like milk, paneer, etc. Then another thing is I would advise them to include omega-3 fatty acids in their diet, which includes like fish, nuts like flax seeds, chia seeds, etc. And also a lot of probiotics in their diet, and also high fiber diet in their which is recommended, which is more than 30 grams if you can include, it's good enough range. So the skincare tips for those suffering from acne are, one, when the patient comes to me, first and foremost, I tell them do not do any DIYs at home. That is, using any toothpaste or any baking soda or lemon, as it is going to just damage your skin barrier more. Secondly, do not take any advices from your friends or relatives. Always consult a dermatologist first when you have acne concerns. Thirdly, whenever you're opting for any cosmetics or any skincare products, always look for the label non-comedogenic, as that will really help. And also when you're opting for products, opt for gel-based products over cream-based, that will also, which are less comedogenic in nature. And avoid use of any heavy cosmetics on your face if you're acne prone. Avoiding use of, do not wash your face too many times in the day, as that will also again further damage your skin barrier and lead to acne. So it really, when the patient presents to us, first we rule out what is actually the causage for the acne. First, if the patient is in the adolescent age group, then we come to know it's a cause is the teenage acne or adolescent acne. So we treat accordingly. If it's a female presenting to us with acne, then we rule out the case of cause of PCOD if the patient has. Then along with the help of the obstetrics and gynecology department, we evaluate the patient completely to rule out PCOD as well. And then we treat the patient accordingly. So the various treatment options available in the OPD basis are, one is the applications of creams and gels which are prescribed by us. Then we have oral treatments in the form of antibiotics and oral retinoids which are given after proper consultation with the patient. And then the other procedures per se which are done for the acne point of view in the OPD, we have like lasers, we have chemical peeling which is done, we have comedone extraction where we remove manually the blackheads and whiteheads. Then the another part of the acne which is there, that is the acne scarring, which many of the patients present to us in the late stages. If they are not treated in the early stages, they present with acne scar. So for the acne scars, we have another subset of treatments ranging from subcision, then we have microneedling, radiofrequency, MNRF and CO2 laser. So depending upon the depth and the intensity of the scarring, we have to treat the patient.